Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's home exercise tutorial, we are going to build on what we started last week, or what I started last week when I was talking about normal mechanics of the shoulder and how to regain the ability to lift your arm up, and some of the problems that might be interfering with your ability to reconnect with those muscles that do that motion. So lifting this part of the arm upwards. If you didn't watch that video, I highly recommend that you stop this video, you go back and you watch that one, because it'll make this video make a whole lot more sense. But before we do that, if you haven't yet subscribed to my channel, go ahead and hit that subscribe button, turn on that notification bell so that you'll be notified when I upload new videos. So let's go ahead and get started. So as I had mentioned, in the previous video, just to recap, I talked about that shoulder blade or scapula, that bone on the back side, and the importance of that bone moving in order to lift the arm bone. So when I say lift the arm bone, I really mean shoulder flexion. So going up in that direction. And in that video, I also talked some of the muscles that are usually tight that would interfere with that scapula moving the way that it should. And then I gave you some stretches to do for that. So hopefully you guys have been working on that this week. Some of you commented that they were helping, so I'm super happy about that. If you haven't tried them out for yourself yet, I encourage you to incorporate them into your home exercise program if your ultimate goal is to regain the ability to lift the arm. So just a little bit more of a review of what normal mechanics of the shoulder are like. So when I talk about that backbone moving, that shoulder blade bone moving, I talked about the ability for it to tip upwards and also to tip back just a little bit. And really the humerus or the arm bone and that shoulder blade muscle, they kind of work in rhythm together. And that's really, really critical. So for one bone to move efficiently, they both kind of need to move, and they need to move at the right time. And that's really important when I get to some of the problems that can happen after a stroke. So you might have some arm movement or movement of the humerus bone, and you might have some movement of the shoulder blade, but are they moving at the right time, and are they coordinating together? And that is usually the problem after a stroke or hemiplegia or MS, anything where your connection with that movement has been affected. And so when I talk about some of the problems that happen after you have lost some of that brain's ability to control these muscles, there are a variety of things that can go wrong. When I bring up a problem, it's usually because someone has presented a specific problem that they are having, and then I'm building the video with a vision of that person's particular problem. So don't think every video that I show or every problem that I talk about is going to be your exact problem. What I'm hoping you can do is build some awareness around what your particular movement problems are, and that hopefully you can find the videos that apply to you. But again, this is not the only problem that can happen with the shoulder. There are a variety of things that can go wrong, but one of the main things that I see after a stroke or damage to the part of the brain that controls the arm is that you lose that rhythm. Usually this is due to the stronger muscles taking over whenever you try and go and lift the arm, and the weaker muscles obviously not doing what they need to do, so you're not staying in that rhythm. And when that shoulder blade does not move appropriately at the right time, it's either going to cause pain when you lift your arm overhead, or as I talked about in the last video, when you go to sit up. So a lot of times I always start with someone laying down to work on lifting the arm, and then when you go to sit up, you can't do it. So maybe you get really good at it laying down, but when you go to sit up, you're unable to do it. That might be due to the fact that you've lost some of that rhythm. In the last video, I talked to the reason it's maybe easier in laying down is because the way that gravity acts on that shoulder blade kind of gets positioned in a better position to make the muscles that lift the arm more efficient. Again, go back and watch that video because I definitely go into that in a little bit more depth. So in this particular case that I'm envisioning of one of the major problems that can happen are all those muscles I talked about that are tight that I showed you how to stretch in the previous video. They're also usually overactive. So what happens is when you do anything that is challenging for your brain or a little bit difficult, and lifting would be one of those things, the stronger muscles or the overactive muscles pretty much take over. So when you're trying to lift the arm and you're trying to tip that shoulder blade, or you're not trying, but we want that shoulder blade to tip backwards and rotate upwards, it can't do it because of the overactive latissimus dorsi bicep. Now again, not everyone has an overactive bicep, but it can contribute. The pectoralis muscles, the teres minor, all of those muscles together are overworking. Then that is going to, when you go to lift the arm, instead of it rotating, tipping back and rotating upward, it's going to pull it down and forward. And that makes it very, very challenging for the muscles that you don't have a strong connection with to have the efficiency or the right pull on the bones to raise the arm upward. Now, there are many of you out there, again, that this video is not going to apply to. There's a lot of people out there that have the opposite problem, and the shoulder blade actually goes backward when you go to move it. So this is just focused on those of you, when you look in the mirror, if that arm is dropped down and forward, then I would say these are the muscles that are overactive. So what is the solution? How do you restore that normal, nice rhythm of that shoulder blade and that arm bone to improve your ability to reach overhead? And I kind of break it down into 3 steps. Step 1 would be to just isolate the shoulder blade and restore good movement of the shoulder blade, working on that upward rotation. I would say actually working in all directions. You want to be able to move the shoulder blade without the arm pulling in. So you really need to be able to isolate movement around that shoulder blade. The second component would be to isolate movement of the humerus, particularly external rotation and flexion, and something we call a diagonal pattern, where you are kind of going on like a 45-degree angle, to isolate those movements without getting a lot of abnormal movement of the shoulder blade. And then the third step would be to try and put the two together. So retrain that nice rhythm where the arm bone and the shoulder blade are working together. The reason I break it down that way is because of spasticity or abnormal movement patterns. They have a tendency to go together and not in a good way. Again, when you go to lift that arm up, you've got some of the shoulder blade muscles that are overactive pulling it forward. So we really don't want that. So to isolate each bone and get good movement at each bone and then put it all together, for me, I find to be the most effective way. So that step 1, isolating the shoulder blade that I talked about, it's a pretty easy exercise. The only thing I add that I don't think a lot of people do is I add a dowel rod to the arm, in the hands. That's extremely important because, again, when you go to move that shoulder blade and isolate those movements, a lot of times that arm wants to rotate in, mainly because of that latissimus dorsi and the pectoralis, those 2 muscles, a little bit overactive. So the dowel rod with your hands, palms facing up, and if you need to strap the weaker arm to it, I highly recommend that. It stops that movement of the humerus that we do not want. So it stops that and allows you to just isolate the shoulder blade. And then you're just going to work on elevation, retraction, and depression. You don't really need to work on what we call protraction, which is bringing them forward, because that's not really a movement involved in reaching. And a lot of times, again, all those muscles are overactive, so you don't really need to work on that. If you find that it's doing that involuntarily, then definitely the best way to get rid of that is to work retraction, which is the movement exactly opposite the protraction. So dowel rod in your hands, and then you're just gonna do circles. Pause at each point to make sure that you're really isolating each movement. I would do both shoulders and do it in front of a mirror so that you can watch and compare it to your other side and try and make them look very similar. Now, again, some of you, the muscles that raise that shoulder blade up are overactive. And in that case, I would work more on the retraction, so bringing the shoulder blades backwards and down. Some of you, though, when you go to raise your arms up, you're going to see that the strong arm goes right up to your ear, strong shoulder, and the other one doesn't move at all. Then you would really want to focus on that elevation. And so that is how you isolate the shoulder blade. And that is it. That is all I'm going over today. In typical me fashion, what started out as something that was going to be done in 2 videos, I realized it was getting really long. And also, I think it's beneficial to focus on each component of the movement separately and spend a little time on it before moving on to the next progression. So in next week's video, I'm going to show you how to isolate just the arm movement. I'm also going to show you clips of an actual treatment where I did this progression with a patient and the progress that they made just within 1 session. And then I'll do a video with some exercises on how to put it all together. Now, I've gotten some really great comments and questions just saying, well, I can't keep my arm straight when I do this, or I can't use my other arm to help me in some of the shoulder exercises that you show. And that is totally understandable. The problems that happen after a stroke, they vary greatly in their severity, and all of you are at different stages in your recovery. So what I'm going to do is at the end, I'm going to link to a playlist on the shoulder videos that I have created in the past, and hopefully you can find a video in there that addresses your arm problems and gives you solutions for where you're at in your stage of recovery. So I hope all that made sense. I hope you all enjoyed this video. Again, if you haven't subscribed, go ahead and hit that subscribe button, turn on that notification bell. Definitely leave your comments. This is the best place to be able to get an answer to your questions. So leave them here. I enjoyed spending time with you all today, and I look forward to seeing you all in the next video. You all have a great day.